Show me your teeth. Show me your teeth. Show me your teeth.
As you all know, a dentist diagnoses and then treats teeth and maxillofacial problems. We work to prevent diseases of the teeth and surrounding structures. We also assess and manage the relationship of these structures to the patient's general health. Optimal oral health can also be a significant factor in preventing or improving other major health issues. We often work with a team, either in private offices, community health centers, or in hospital-based clinics. Last year, for example, I worked in a dental clinic at the Mount Sinai Hospital treating medically complex or special needs patients. This sometimes meant putting the patient to sleep and treating them in the operating room with an anesthesiologist and a team of nurses.
Radiation therapy involves the use of targeted ionizing radiation to destroy cancer cells while minimizing damage to normal tissue. Radiation therapists are employed almost exclusively in regional cancer centers throughout the province, where we are key members of the cancer treatment team and are directly involved in treatment planning, treatment delivery, and patient care. As part of the cancer treatment team, radiation therapists work closely with radiation oncologists, medical physicists, nurses, dietitians, and patients to ensure the delivery of safe and effective treatment while maintaining a patient-centered care approach in the management of radiation-related side effects.
Nuclear medicine uses radioactive isotopes to document the structure and function of organs. As a nuclear medicine technologist, you will meet patients of all ages. The variety of patients that you encounter will depend on whether you work in a hospital or a private clinic. In a hospital setting, you will meet a lot of inpatients, and it's important to know a bit of their history so that you can make their scan as easy as possible for them.
Hi, my name is Alex, and I recently graduated from the Radiological Technology program. My job consists of basically providing images of the patient's anatomy using complex medical equipment such as basic x-rays, fluoroscopy, which is real-time x-rays, and multi-slice CT scanners. When we do these images, they are used to diagnose and treat the patient with the help of the entire healthcare team. This is done in the most safe way possible, with protection for the patient, members of the healthcare team, and the public.
Hi. Doctors aim to maintain, restore, or improve physical and mental health through health promotion, prevention, diagnosis, and management of disease and injury, while taking into consideration and examining the many factors that may be influencing one's health. Physicians care for patients of all ages and may do things such as diagnose illness, order and perform diagnostic tests, prescribe and administer medications, perform surgery, conduct research, and manage psychosocial issues. On an interdisciplinary team, physicians often focus on the diagnosis and medical or surgical management of disease and injury, while working with colleagues to advance optimal health for patients, families, and the community.
Nurses work to restore, maintain, and advance the health and well-being of individuals, groups, and communities by applying their knowledge, skill, and judgment in a compassionate manner. RNs coordinate healthcare, deliver direct patient care, and support clients in their self-care decisions through all stages of life. In the hospital, nurses coordinate care, dispense medications, perform ongoing health assessments, and provide health teaching. However, nurses work in many other settings, such as rehabilitation, mental health, home care, on the street, in classrooms, and much more. They're involved in patient care, education, administration, research, and policy. In addition, advanced practice roles such as nurse practitioners and clinical nurse specialists have nurses working in new and exciting places with expanded scopes of practice. During one rotation, I worked on a pediatric burns and plastics unit. I participated in team burn rounds and collaborated with a variety of professions and services in order to coordinate my patients' treatments, tests, schoolwork, and activities of daily living. I always ensured my patients felt both emotionally and physically supported and collaborated with the child life specialist to ensure kids had time to just be kids.
Occupational therapists help people affected by illness, injury, disability, developmental disorders, psychological problems, and aging
maintain, restore, or increase their ability to care for themselves and to engage in work, school, or leisure. This may include working with clients to find new ways of doing things, modifying the environment, adapting materials and equipment for use, or prescribing assistive devices such as wheelchairs. OTs work in almost all wards of the hospitals, in rehabilitation centers, in schools, in clinics, and in people's homes. In the hospital environment, OTs perform cognitive assessments, help patients regain their functional independence, and ensure they have all the proper equipment and support they need to return home. In the hospital, I worked on general medicine floor. I ran it with the team twice a week, determining when patients were medically, physically, and cognitively safe to return home.
As a pharmacist, I'm an expert in pharmaceutical care. That means I assess and make sure that my patients' drug-related needs are met. That may mean I explain to them why they're on 3 different things for blood pressure, help them adjust their insulin regimen, tell them about side effects to watch out for, and also listen to their concerns because it would do them no good if their meds were collecting dust by the bedside. I also listen to their team. I round the team, I answer any questions that they might have, and also monitor their progress because to make sure that the medications are appropriate, effective, and safe.
Hi there. Some physiotherapists may choose to work in specific clinical settings, such as women's health, seniors' health, orthopedics, children's health, sports injuries, rheumatology, or oncology. Some job descriptions of physical therapists include assessing a patient's physical abilities and needs, providing a treatment protocol to meet those individual needs of that patient, and this can range from therapeutic exercises to mobilizations to even education to the patient. And finally, as a consultation in terms of injury prevention and health promotion.
Hello, my name is Jessica Quay, and I'm a third-year student at the Faculty of Physical Health and Education. Our program offers 3 degree programs. One is a Bachelor of Physical Health and Education, one is a Bachelor of Kinesiology, and one is a collaborative program between the Bachelor of Physical Health and Education as well as the Bachelor of Education. Our program not only focuses on the physiological well-being of individuals, but on the psychological aspect as well. And you may see somebody with one of our degrees helping out on an interdisciplinary team with a professional athlete alongside chiros, physios, and psychologists.
Social work is a field dedicated to helping individuals and communities develop their ability to resolve individual and social problems. Social workers work in many different settings, healthcare being just one of those settings, with clients of every age group. Our patients' concerns range from chronic to acute, from mental health to mobility, so you'll find us in every area of the healthcare system. We spend time with the patient to gain a holistic view of their life, including external factors that affect their overall well-being on a day-to-day basis, such as social support systems, cultural influences, financial and health insurance situations. We then use this information to help the IPE team create a treatment plan that not only addresses their healthcare needs, but is also manageable and realistic for the patient.
Hi, my name's Shannon, and I'm going into my second year of speech-language pathology. And basically what speech-language pathologists are we're experts in communication and swallowing disorders. We work with all ages and many different populations of people. We work with children with language or articulation impairments. We work with the deaf and hard of hearing community, people with autism, people who've had strokes, people who stutter, and many, many more. And in this profession, it's very important to be able to work together with other professions. For example, I worked at a children's rehab hospital, and we'd have team meetings for autism assessments, and everyone would give their part with information about the child that we were working with. And my part would be to give information about their communication and language abilities, and then the OTs, the psychologists, the doctors, the social workers would all give their input as well. And so in that way we're able to bring the most information together and put it together to give the best care possible to that child.
provide, again?
Okay. Perform surgeries, order and prescribe COT.
Hi there. Some physiotherapists
to destroy cancer cells while maintaining crap.
That's okay.
And basically what a speech language pathologist is,
Okay.